not quite what has been happening in biomedicine for all sorts of obvious reasons, and we have a lot of work to do there. Now, obviously, I don't really need to, the elephant in the room here is the market, particularly when it comes to the value and the valuing of biomedical data, personal data, and data in general. I mean, we're obviously looking at it's a huge potential market which is profoundly under-regulated. So, I'm a very big fan of regulations coming into this because I think there's huge risk associated with this. We've seen lots of different failures or problems emerging, particularly with corporations like Google actually appropriating personal data from people all over the world to do all sorts of interesting things with them without any authorization or any accountability. But many different entities are doing this. This is particularly, of course, problematic when one thinks about clinically actionable analytics, which I mentioned before. I mean, on one hand, that's an area that you absolutely want to explore because the potential here is immense of actually having better diagnosis, better tools available to doctors wherever they are in the world. But the problem is that this keeps being seen as a sort of cost-cutting measure. Okay, we're going to have now all this fantastic automation. That means that we have to invest even less in medical systems because doctors will just know what to do because the computer will tell them. And everything we're seeing in this area says exactly the opposite. The more data-intensive system you're using, potentially the better the clinical outcomes and the outcomes for other parts of biomedical research could be. But that's very labor-intensive. You will have more experts involved. You will require more labor behind it. So you potentially could have a better outcome, but it's going to actually cost more. That's sort of the lesson there. And of course, there's big issues around where does the liability lie, particularly in situations when you start to do data work, which has more and more immediate implications, either for public policy or for decisions about particular groups of patients. Where, I mean, what is the role of researchers who are doing interpretation here, the role of data curators? I mean, how do we rethink accountabilities and liability in this system? Still a very, very big issue. In particular, a big issue when we think about intellectual property regimes, which is the next and final thing I wanted to touch upon. Again, huge elephant in the room. I mean, there are, of course, wonderful data sets that come from the government in this area, but there's a huge variety of data types coming from the private sector, and things like social media, which are, again, very, very interesting characteristics, but any other type. And this brings its own very big challenges here. And one of the challenges, I think, which is maybe discussed less than should, is the fact that there's lots of work on producing management tools, analytic tools that relate to these kinds of data. But partly because of the IP fears and issues around them, a lot of these systems remain local. So there's very little sharing of those experiences, and very often these systems are not portable. So progress is slower in this area than it could be because of these issues. And I mean, here I think it's very important to think about this notion of data visiting. That's something that the CODATA International Council of Science now have officially endorsed as a new way of thinking about data sharing, which I'm extremely happy because I've been trying to argue for that for a long time. So the idea being, well, for maybe many types of data, particularly those health-related, we may need to focus not so much on sharing, sort of indiscriminately, even in a fair way, but in fact on keeping, but allowing for data searches to happen across different institutions. And of course, some of this work of data visiting is by, in fact, visiting specific physical locations, and that's in many ways also the example here of the secure data room, where you can only do that kind of work there, and you're not going to be able to remove the data from there. But there's also lots of attempts to try and do this in a virtual sense. For instance, by running algorithms that, I mean, basically what people then will do is not so much approve your request to access certain data as a user. They would approve your request to run a certain algorithm through your data. Right? Very, very different set of competencies, very different approach to this. But that's something that's been piloted in certain different places in Europe. Some colleagues in Bristol are doing this, they're calling this the data shield. But I think that's something that really has a lot of promise because potentially can resolve some of these big governance issues around data. So just coming to a conclusion, what I wanted to highlight in this presentation is that placing data science, data curation, of course, the artificial intelligence that comes grounded on the services at the service of public health means the following. First of all, placing more attention and resources on data linkage and its role in the digital transformation of research. It's very, very important. It's still underestimated. I really do hope that Brazil will recognize more and more the importance of places like Cidacs in this respect. And because this really affects everything, certainly within the world of research, it affects how you publish, how you communicate your results, how you think about division of labor, how do you think about attributing credit for discoveries, and of course, the very boundaries of what it means to do scientific work and what it means to think about science, potentially. It also means acknowledging that data travels are things that are very challenging, and they may challenge a lot of expectations you have, including things like institutional boundaries, disciplinary, cultural, sometimes even national boundaries. And that has been, it's not a new thing, that's been always happening in the history of data for many centuries. But of course now this trajectory is accelerated by the huge opportunities that are opened up by the very fast travel of digital data. As I said, trying to think about ways of protecting rights of individuals as well as communities in this respect. And generally just being very aware and highlighting how this big data landscape is in fact extremely fragile and therefore needs like huge levels of cost-intensive safeguards around it. To think about data quality issues, to think about the sustainability issue, like how to find novelty in this system, which actually is almost by definition quite conservative because it keeps reworking and reworking data that have been collected in the past. And how does one think about the marketization of this versus the idea of public service and public good that underpins a lot of the research that goes on here. And with this, I thank you very much for the attention. These are just some of our publications are on that website if you're interested.
So much.